types of domains in which the HRV is analyzed. One is the time domain, frequency domain, and nonlinear parameters. So time domain parameters are what? Time domain dependent upon the duration. These are the mathematical expressions which are calculated by the duration between the RR intervals. Routinely what we use, that is SDNN, RMSSD and PNN50. So these parameters will give you the information regarding the overall variability. So if I say the SDNN is increased, that means my HRV is getting higher. So overall variability is shown by these parameters, and these are the, on this table you can see there are other mathematical expressions which are used as the time domain parameters. Moving ahead with the frequency domain. Now what it is? So I'm giving one example, that if you pass the light ray through a prism and then it will spread into a spectrum. So that way when we pass that data of ECG into that software, it will show the complete spectrum of your HRV, that at what rate this is collected, at what rate the variability is happening. So there are various frequency zones which we can get in a HRV spectrum. So frequency zones are like you can see on the screen, HF, LF, there is also VLF, ULF, and overall it is called the total power of the ECG, total power of HRV. So total power will give you the idea about the overall variability. HF and LF zones, these are the routinely used frequency zones which will give you the information regarding the parasympathetic action or vagal action on the heart. So these are the various parameters of the frequency domain. Here you can see in this table. Nonlinear parameters will give you the complex idea about the HRV. Why complex idea? Because HRV is affected by n number of parameters throughout the day, and how these complexities are interrelated, are working, they are regulated and showing the heart rate variability, that is depicted by non-linear parameters. Non-linear measurements are these point care, entropy, detrended, and correlation dimensions. So here